Hi, Brave Moms. I'm Priscilla from Kindred Bravely, and I'm here today with Kristen.
Hi, I'm an RN at Door County Medical Center. I've worked in the birthing center, which includes labor, delivery, postpartum, and nursery for the past 20 years. I've been a part of probably thousands of deliveries. Actually, I met Priscilla through work.
Yeah, she took care of me when I was very pregnant and had just moved here to Door County. And Kristen was wonderful because I was a little bit high risk.
So there's certain conditions in pregnancy that can make you at an increased risk. It can be sometimes very dangerous for both mom and baby. And one of the ways that Priscilla and I bonded was actually through her non-stress tests. We call them NSTs.
And this is what we're here to talk about today, guys, because we get lots of questions about signs of labor. And I mean, who else can be more of an expert than Kristen?
Well, to be honest, sometimes we just don't know. And I actually, with my first, had that question like, oh my gosh, do I go or not? And of course, I was 3 weeks early and my husband's like, no, it's too soon. You're not ready. But I had that motherly instinct and I knew that it was time to go to the hospital.
Let's say that it's your first baby,
Yeah.
right? And then you're not sure if you're having a Braxton Hicks or if you're actually in real
Sure.
labor. What would you say to your patient or to
Okay.
yourself if
Yes.
it was your first baby? What
Yeah.
would you say? Okay, this is definitely a sign for you to come to the hospital.
Okay, so we try to make it simple. The 5-1-1 rule. Okay, so you're having contractions every 5 minutes, lasting a full minute, okay, for an hour. So you need to just keep track. Another good indication would be are the contractions, so with the 5 minutes, they're fairly consistent, right? Are they getting stronger? And are they distracting you from your work? If you're able to text on the phone or, go on your computer, you're probably safe to stay home.
Okay.
I encourage a lot of moms to call our department ahead of time, and I can tell just by talking on the phone with them. If they can't carry on a conversation, it's time to
It's
head
time
on
to
in.
come.
Yeah.
Gotcha.
Yeah.
That is a good point. If you
So-
can't carry out a conversation, you have to go to the hospital.
Exactly. I would say that's a very good thing. The other thing is your water breaking. So, for some moms, it happens in labor, but for a good portion, it happens ahead of time. And our policy at our hospital, it's very different around the country, but our policy is if your water breaks, you got to head right on in, even if you don't have contractions. That amniotic membrane is a protectant for mom and baby, and it also regulates baby's temperature. And also just, is like I said, that barrier so bacteria doesn't get inside. It's also the cushion for the baby. So once the water breaks, their swimming pool is starting to drain, and then things can get compressed or squished easier. Really good idea once that water breaks. I always tell people don't get in an accident racing here, but please don't take several hours because it's best to just get checked out.
Gotcha. My sister had her water breaking and then she was like, I'm just gonna take a shower. By the time she got to the hospital, baby was basically coming out. So
Yeah.
that's a good point.
That's another thing is babies can come fast
Yeah.
after that. I would say with my second, I was kind of surprised when I got up in the morning and I'm like, oh, it's not my water. And I knew it was. There was no denying it. I tried to, and within a little bit. Sometimes it's just a slow trickle and where you're thinking like, okay, I need to have a pad on or something like that. And that's usually when it breaks early on. When it's a big gush, then it's quite apparent. And that happens also when you're at home or the grocery store or somewhere. But surprisingly, in all the deliveries I've seen, there's been very few incidents where the moms had an embarrassing moment. Like I was in the grocery store and the water broke. It's usually at home.
Just on the movies.
Yeah, just on the movies, exactly. I have heard some tips from moms that, just keep a garbage bag in your car so you can put something on the seat. I actually cheated and had a pad at home that I just snuck in.
That's a good
Yeah,
idea.
it is
That's
a good
definitely
idea.
good
Yeah.
idea.
So I would say the regular contractions that are taking your breath away where you can't converse, the water breaking, or I would say that's the two biggest keys, or as advised by your provider. There are some warning signs that maybe don't necessarily mean labor, but definitely need to get checked out, and that would be any bleeding, like heavier than spotting. So sometimes after an exam, or if you happen to be intimate with your partner, that can cause little blood vessels in the cervix to break and you can have spotting. But anything where you feel like you need a pad or blood is running down your leg, that's a big warning sign. You need to come on in. And certainly if you're not feeling baby move as much as normal, then definitely you want to give a call. It'd probably be a really good idea to drink something or eat something because babies need energy too. And then you'd want to let us know.
Yeah. And I remember when I was doing my known stress test with you, you always had me drink really cold icy water so
the
that
baby up.
Yeah.
Yeah. And they like sugar too. Apple juice is a very good thing too. And a lot of times moms get busy with their everyday life and they're not even sure they have movements going on. And then once we say, well, why don't you lay down on your side? Always best to be on a side. And that just helps with blood flow to the baby. You don't ever want to be flat on your back. You won't feel good, and neither will baby. But if you lie on your side and take a drink of water or something cold, those babies usually perk right up.
Right.
But you have to stop and pay attention.
That is true.
Yeah.
Oh, that's awesome. Thank you so much for all the tips, Kristen.
Of course.
These are super helpful. I'm sure our brave moms will really appreciate them.
And moms are brave. They are rock stars. Yeah.
Thanks so much for watching, guys. I'll see you soon.